Can Xanax cause diarrhea? Yes, Xanax, also known by its generic name alprazolam, can cause diarrhea as a potential side effect. Xanax belongs to a class of medications called benzodiazepines, which are commonly prescribed for the treatment of anxiety and panic disorders. Diarrhea is listed as a less common side effect of Xanax, meaning it occurs in less than 10% of people who take the medication. Other common side effects of Xanax include drowsiness, dizziness, headache, dry mouth, and changes in appetite. The exact mechanism by which Xanax may cause diarrhea is not fully understood. However, it is believed to be related to the way the medication affects the gastrointestinal system. Xanax can alter the normal functioning of the digestive tract, leading to an increase in bowel movements and loose stools. It's important to note that not everyone who takes Xanax will experience diarrhea. Side effects can vary from person to person, and some individuals may be more sensitive to the medication than others. If you are experiencing diarrhea or any other bothersome side effect while taking Xanax, it is recommended to speak with your healthcare provider. Here are a few examples of conversations where individuals have reported diarrhea as a side effect of Xanax. User A: I've been taking Xanax for my anxiety, and I've noticed that I've been having diarrhea more frequently. Could it be caused by the medication? User B: I had the same experience. I started taking Xanax a few weeks ago, and since then, I've had loose stools almost every day. I think it might be a side effect. User C: I've been on Xanax for a while now, and I haven't experienced any digestive issues. It's interesting how medications can affect people differently. Remember, if you have any concerns or questions about the side effects of Xanax or any other medication, it's always best to consult with a healthcare professional.